Okay. About the answer the question that you ask, if it's spiritual or we have different type of causes or etiology of mental disorder. Sometimes you find that the person was maybe involved in the car accident and maybe something happened, head trauma.
Car accident?
Yes, or any head trauma or any injury or a tumor in the brain. It can lead to these dysfunctions of the...
Substance abuse.
Yes.
So what's substance abuse too?
That got nothing to do with a spiritual thing.
Wow.
Because if you ask the history
That
of the...
would be a shock for
if you ask the history of the
pastors.
patient, you come to learn that no, in 19 what,
But
he
why
was
is,
in a
it
car
that
accident.
why is it that the Christian doctors go to those churches and they don't dispute this? They don't argue with pastors.
They are members. They are part of them. They are part of their system.
Okay.
Just like if I talk about Mr. Ni Okai, Mr. Ni Okai have even a right to mention about them giving injection. But according to his name, I can't even see Dr. Ni Okai or something. Who give him the authority to comment on the medical? Who is he to give to mention, to comment on the treatments or the medication that they give to the people? Why he's not even a medical personnel or a doctor? And then again, looking to this, you find a person is mentally disturbed, but that person is sick. Like the one that they were showing, you could see he's under the blankets, but you could see he's very thin, meaning apart from his mentally disorder, there's another sickness. And you don't know if that mentally disorder is it's caused by the disease that he's having. Because you can find people like even in HIV patients. In HIV patients, HIV/AIDS patient, you can find this HIV patient in the severe state. It can lead, you can find this person having this mentally disturbancy. And here they lock him in the whatever, instead of treating what is causing the mentally disorder. You find a person like, for instance, a person is diabetic, electoral imbalance. Person can come talking other things. And you think that, this person maybe is mentally disturbed. But it's just because of the electoral imbalance in his body. Balance the sodium, balance the potassium, you see this person will calm down. And then again, you come a person like, this person is having malaria. Yeah, but this person will appear like mentally disturbed. Will be talking things without listening.
So why should we call them mad people then? We should even eliminate that word, mad.
Yes. Like this man that I've seen here, this man need treatment. They treat him, the one under the white blankets. Treat what it's, because he looks thin, and the reason even that he's not standing, I think he can't even be able to stand.
This person sitting down there in the corner, and this one sitting down there, that one there, are they aware that they are all there? Why are they not fellowshipping? Why are they not relating?
Yeah, it's one of the things that comes with the psychiatry. They could be
as if they don't see each other.
Yeah, they could be depressed actually. And one of the signs of depression is that, and it could also be an antisocial, because if you're depressed, you're in your world, you don't want to talk to anybody, and they could even develop what we call apathy, where and abulia, because abulia.
No, but somebody who is depressed is aware of everything, only is isolated in himself. So what is he thinking when they then put chain on his leg?
if they put chain on his leg and he's depressed, he can be there for days and he won't say anything. Depressed. Okay. Yeah, no, I've interviewed depressed people. It's so difficult to get stuff from depressed people.
Okay, so they chain him down and he's depressed. He's just
going to sit. You think he's even, you can be there just because, even without being chained, when you see severely depressed people, they're just like this. Yeah, you interview them, they're like this.
But he's aware of everything.
They're fully aware, but they're not talking, they're not replying, they're not even, there's no contact, because that's one of the things we also see. What is the contact at the patient? So you see a depressed patient, really depressed, he's just looking down. You ask him, how are you? It takes him like 2 minutes to answer, okay, fine. That's how they act. So now, because now I'm telling you what I've seen. So these guys, if they are depressed and they are chained, they're just going to be seated there, just in their own world, just thinking about how and that's what leads to suicidal thoughts, and then they also can take their lives.
But so are they aware that they are shamed?
Yeah, they are. They are. They're fully aware that they are changed.
Are you sure?
Yes.
Even for them to change them, there was a big fight.
They
They
are.
didn't want it?
No.
Yeah, they will resist it, especially if.
But when they fight, they think that they are crazy now.
They are fully aware. They are aware. They are aware of their surroundings.
But it even reduces their chances of being healed
Yes.
when they see that they are shamed down.
Yes.
Then it brings out anger and aggression.
That's it.
No?
That's it. It irritates them, and it gets them even more. It increases the whole process that is going on in their minds, because one of the things that triggers, like for example, a mania patient, most times people who have mania disorders, there is something that triggers mania. For example, I interviewed a patient who likes to play his guitar very loudly. Now, anyone so he doesn't play every time, but anytime he wants to play, if you stop him from playing it and you tell him you're making noise, bam, he moves into his aggressive states. And just by saying, hey, stop, don't play it, it's too loud. He almost killed his brother because of that. Because he was making so much noise in his room, and everybody around was like, why are you making noise? He doesn't do that every time, but he just comes up, he wants to make that stuff. And then you stop him, he just becomes aggressive and wants to kill everybody. So they get him. So can you imagine that? And that's because you're trying to even force him to do what you're doing. Even in psychiatry, we are taught that when you're interviewing a patient and you discover that the patient doesn't want to give you the answer you're looking for, and you because you have to study your patient's his response to the questions. So the moment because we're trying to figure out what is wrong, how is he feeling, the moment you discover that a bipolar patient or a patient with mania is already getting aggressive with his answers, pull back. Don't push further. Don't ask him.
There was another instance of video in Ghana too, when a pastor was going and he was physically wrestling them down. And then they cool down. It's like overpowers them. And then he washes them and they become okay. What is that?
So for someone that, for example, I watched the video, like the guy that they tried to chain, and then, you see, these guys...
And then they become normal.
Yes. Before the guy coming to meet those people, they are normal. Yes, now.
Yeah, they were normal, yeah.
They were normal. Nothing was wrong. The only reason...
But he was sitting there in the streets.
He was sitting down on the streets, naked. Because he has the whole psychiatric issue.
Okay.
Naked. He's just there. He doesn't have any problem with it. He's naked because there's a problem upstairs. So, and if you don't come to disturb him, he's not disturbing you. He's just doing his own thing.
Yeah. Most people in Africa, bad people.
They're not coming. They will not fight.
But then the pastor comes and,
trigger.
Yes.
Then he gives his normal response. The aggressive, why are you trying to fight with me? I'm okay. Normal. I'm fine. I'm okay. Nothing's wrong with me. Why are you fighting me? Why do you want to overpower me? Then if the person that is trying to, like the man, I saw the man was big. As soon as he overpowers the person, then the person submits. Because it's normal. It's nothing wrong. But it's just like, I'm coming to fight with you.
But that doesn't mean, because he's submitted like that doesn't mean that he's healed.
No.
But the Africans say he has been healed then.
They do have their episodes, actually. Let me start from what the doctor has just explained, that there's always, there could be comorbidity to their problem, their presenting problem. And people...
What is comorbidity?
Comorbidity is when someone is depressed and is presenting with delusion or schizophrenia, or when somebody is having anxiety and having a bereavement issue. So there's comorbid situation, diagnosis there.
Like double?
Yeah, double or more.
There's a main symptom, there's a main challenge.
Okay.
For example, someone who has an obsessive compulsive disorder, which could be intrusion, and you've got as well hoarding.
What?
Hoarding, like you collect items.
Okay.
You can't give away, you just collect things. So, and that's one of the things that we see on our African street. So they do collect things they don't want to let go. It's actually symptoms of OCD, actually. So, and where the problem...
So it's a form of mental disorder?
Yes. And it's because there is a problem in the neural pathway in the brain, which has to be, there should be immediate intervention. I say, okay, we don't want you to start hoarding on the street. Now we remove you from the community and put you in a unit, whereby someone will be going there, making sure that there is no rubbish, it won't even have access to anything. So someone who has got schizophrenia, who talks, and it's not 24/7. So the time that is having that episode, if it's not violent, just engage that person. It's just an engagement, talking. You don't see them as being dangerous. You engage them. If it's violent, then they administer drug, and it's for a while. The drug will tranquilate them or make them relax. So that is what we are seeing in Africa. We are actually really complicating that problem.
Well, there is something they call in Yoruba, they say he has gone to town or something, Oti Shobo, Oti Yagbo.
Yeah, stigma.
No, they call it something, Oti Georgia or something.
Oti Jaoja. It's enter market. It's not.
Is that the way they say? I don't think, is that the way they say?
Yes, sir. Yes.
Oti Waja or Oti Jasoja.
And therefore, there's no cure.
That's what people say.
That's what people say. And
but it is rubbish. Eh?
It's rubbish. These people, they go.
So when they say that there's no cure in Africa, it's actually rubbish.
It's rubbish.
It's not true.
It's
ignorant.
There's an example of someone who you could be living with someone who has got schizophrenia. Actually.
Okay, why is it that then, when they say, oh, they have taken him to Arrow or to a mental hospital. Yeah, but when they do that, the impression you have is that you never come out of there. Some people are there for 40 years. Some people are there for 30 years. Why that in Africa?
It's the system. It is the system, because the system never actually really it's not a fashion
they could be there for their whole lives. Why?
It's fashion.
They don't discharge them.
Yeah, the system, the treatment is never designed to integrate them into the community.
Okay.
So I've got a client who is not having schizophrenia or anything. She just comes with depression and anxiety. Why? Because his neighbor has got schizophrenia. He's attended hospital and is being integrated into the community. They've certified that he's okay. He can live in his flat. But that doesn't mean that he hasn't got his own episode. So when he's got that episode, the other neighbor will be frightening, become anxious. I cannot live here again. That was what brought her into psychotherapy. But then I was assessing and asking her, and she said she's done everything. The police had come, they've assessed this client, this man, and they said, well, he's okay. It doesn't pose any danger to you or to the community. Can you see that, sir? So it's the awareness. But in our society...
So we should allow him to have his episode, as long as he's not going to damage another person.
That's right. And that is the primary aim of removing them from the society, first to actually really normalize and not to complicate in the developed country. You normalize it, you regulate the whole thing, and then integrate them into the community. They can function, they can go to work, they can go to this...
Oti Waja, whatever. that is Oti Waja. They don't integrate them again.
At all.
But I think here, in this case, I just have the last point now. The problem here with Ghanaian, I think they just need to be punished. Because the
These
whole,
people, these pastors,
not pastor, the health system.
okay,
Because
need
there
to be
is-
punished.
Yes, because the World Health Organization have put everything in
Do
place.
they go to school? Those that psychiatrist that we saw, if he's talking like that, for me, listening to you people, I have an impression that maybe he never went to psychiatric
Or maybe yes.
training.
Because
Maybe it's not because, but it's the head of the psychiatric medical unit. So what school did he finish? Do they have psychiatric training in Africa?
no, in medicine,
They don't have.
in medicine, in medicine,
But what does he know?
in medicine, we don't do things the way we were taught or the way our way. There's rules and regulations from the World Health Organization. Whatever a disease you are treating according to the World Health Organization. That's why each and every year they are releasing the management, yes, the medications and everything and the procedures and the approach to each and every diseases. Even these Ghanaians, they have that. How to manage a mental
have it?
disorder. Yes. And you have to treat according to the way it's stated in the World Health Organization structures.
Maybe he
Don't-
doesn't have it.
They have. That's why even the World Health Organization
Okay,
maybe
let's-
went there to
let's go
see how
ahead.
they are managing their.
Put off the light. Let's see what the guy says. Okay.
So that we do our normal prayers, but at times the injection even makes it very worse. They become more violent. And so the best way to keep them is to put them in the chains.
So what the guy says is not true.
In all of Ghana, there are only 12 practical.
So what he says is not true. That the injection made it worse, and that the best way to do is to put them in shame. So he's just coming up with some stories.
I've been in psychiatric ward.
No, what these guys say.
I want to make it. I've been in psychiatric ward. I've not seen one change.
No, but he's talking about his own
But he's
situation.
in his own situation that they get violent. No matter how violent the person is, you understand? If they are given the right injection, these injections they've been proved and they've been tested. You give the right injection, it brings that person down on the floor immediately.
That actually suggests prayer has no place in treatment.
In treatment.
Here, that is the point. That is it.
Sorry?
Prayer has got
No effect.
Microphone.
prayer has got no place in the treatment of this kind of disorder.
Are you serious?
That's the coolest part that we have to face.
No, it's not. Are you serious?
Prayer,
Then you are going to close all those mountains.
prayer has got no place here
So what will we do with all the camps?
because it has been
No, how are you people know this? Then you are not doing live broadcast. You're supposed to be doing live broadcast about these things now. All those prayer centers must be closed then. Is it true?
absolutely.
But that's the only solution people know in Africa.
Absolutely, it's just I think when we are using
No, but there are Christian doctors in those churches too, who are just quiet and they are saying in the name of Jesus, amen, too. You want to tell me there are no doctors in Redeemer or Mountain of Fire?
I had a discussion with someone yesterday, and that's what is terrible about religion, because as soon as they get into that religious circle, they dump their brain. They just lose their brain. Yes,
You want to tell me there are no pastors? That means
there are doctors in those churches. Even you hear some things that happen in the church that doctors are meant to like immediately get that person out of that church and take him to the hospital. That this should be addressed in the hospital, not in the church. But the doctors will sit down there and join the whole pastors and be praying for something that can be treated, that already has a treatment already. Just give the treatment and the person is already okay. Damaged. those people are just damaged by religion.
No, but even you people are silent now. You people are also culprits. Because if we have not raised this topic now, you people have been silent. Have you not been silent today? Yes. You are just talking among yourselves. You are not going to scream from the house roof.
We would.
Rooftop. You don't know that this is a major problem. All churches is full of them. Camps, mountains. This guy is small self. He wants to say, come and say something. Let me talk.
Two things that comes across very clearly to me was this. When I initially started medicine, and then I would go to church, and people will give testimonies like, doctors scheduled me for a surgery, but pastor prayed for me, and thank God.
Oh, it's not just mental.
No, it's not. This is just, it's cut across.
Oh.
So if a woman has CS, she's seen as not having enough faith. She's not delivering like the Hebrew women. So why should she have a surgery when she could easily deliver a baby by herself?
So this thing we are talking about doesn't only affect the mental.
A lot of people have lost their lives because of that. So when people come to the hospital,
the atrocities of the churches is more than the mental.
It's worse. People are losing their lives day by day based on these things.
And you won't tell me there are doctors in that country?
There are thousands of people that are dying because there are a lot of people, we have instances where people, they are going to be praying and praying and praying, and a patient could be losing blood or something is happening, and they will say they are waiting that God will do it, that the doctor's report is a lie. We cancel doctor's report. Who is a man that has spoken when God has not said, all those kind of things.
All those things you are mentioning, and those are program topics. Like Mayowa is doing. Those are program topics. People will be calling in to testify. You said when you hear testimonies. Tell me some of those testimonies.
So people will give testimonies like, the doctor said I needed surgery. It could be cancer. Cancer is usually like a common thing because when it's at the early stage, we could have surgeries that would, like radical surgeries or those kind of things that will help the patient. So there will be a scheduled surgery, and then the person will come to the pastor, and pastor will say, no, it's a doctor's report. We cancel it. We are going to be praying. So usually they don't go for that surgery until it has become invasive or it has become advanced. And people, and it could be, yeah, it could be. And that is even like in the case of one disease. There are other instances where people will say, oh, I had an headache and doctor said I should take drugs. And then Papa has said this, that this year is our year of divine healing, or this year is our year.
Nobody will be sick.
Nobody will be sick this year. So I discarded the drugs and the headache went by itself. These are testimonies every Sunday in Africa.
So what's wrong with that one?
So the problem now is, initially when I began to study, I was thinking, does it mean that I'm in an evil profession? That I'm in a profession where people are praying against, they don't want our services. So we never understood that medicine itself is a provision of God for divine healing, for healing. So people don't understand, is a very, very distinct concept in Africa. Because people see doctors as evil. They are the ones who
put the wrong diagnosis.
They put the wrong diagnosis. They are the ones who report. God's report is divine health for us. You are. In fact, I remember a very popular GO, Bishop Oyedepo, I've heard him say it again and again, that if you go to the doctors often, they will always find something wrong with you. So it says things like, they did a blood pressure test on me, and the doctor said I had high blood pressure, and I told the doctor that it was your machine, that it's the sphic that has problem, not me. And I never did anything, and today I'm fine. And all those kind of stories and testimonies. So the congregation that is listening do not want to consult doctor for any reason until they die. And they keep dying, even though they say there will be no death that year, people are still dying in those instances. So this is a big problem. When we
we have to, but Mayo, agree with them. I know that Caronis is doing some of my recap of my program, but we still have a lot of hours that are still free. from my own platform. Me, I go give you, for you to have better coverage, bigger coverage. You three of you, you know, you, I know, Victor, any one of you that wants to. So let's say, for example, every 2 o'clock, maybe, or every, whatever you want, or what day you want, you know, that is free. Just come on, like Pastor Sunday is coming, like my wife is doing. And you people will be coming to do some programs like this, anything you want to talk about. Because, especially this health something, I didn't know.
It's a big reference to Benny Hinn. You know, I don't know if you guys had in the news that Benny Hinn almost.
So you people are like me then. You people are suffering too. Just like I am suffering because of the ignorance I'm seeing all around. I know that Nigeria can be fixed, and I have to just sit there and be suffering. But I'm writing books, but I'm doing something at least. So you people too are suffering when you see all those ignorance.
Pastor, is big. Benny Hinn is the huge healing face of
no,
healing
but in
ministry.
Africa, in America, it's rubbish. It's not respected. Even himself cannot defend a lot of his activity by even ordinary journalists. They expose Benny Hinn very easy. We are not even talking of doctors.
Yeah, but even what I'm making reference to him is that even the Benny Hinn himself, that is the healing minister, he almost lost his life. Actually, he even collapsed.
Where?
In which country was that? I think 2015 in the United States. While he was, because he had a heart condition.
Are you serious?
Yes.
How do you know?
All over the news. He himself even gave testimony about it.
He was scheduled to come
to Ukraine, and he didn't come.
He couldn't make it because
I know he couldn't come one time.
It was because of the heart condition. He was rushed to the ICU.
it wasn't divine.
It was not divine healing that saved him. He was rushed to the ICU, intensive care unit. They had to put him in, they had doctors that had to address the healing condition. And the vulnerable people in church who have issues, sicknesses,
They are going to him.
they are waiting for the divine healing.
And they discard doctors' prescriptions. They disobey doctors' prescriptions. They discard them. They don't take their drugs. Don't keep appointments just because they see doctors have become like and that is why there's a lot, because that already nullifies the fundamental principle of healthcare. Because normally, before these things get to all of those stages, all those emergency stages, people should have taken care of themselves. But then, many times when they come to the hospital, there is little or nothing the doctor could do. And that is in an environment where there are little doctors, there are little facilities to take care of the things. Then the bigger problem I see with that video actually is something that is about also the way we dignify patients in Africa. Because not only just, patient generally, how we, in the treatment of patients, the dignity of a patient.
We dignify
like we don't dignify.
Undignify.
Yeah,
Okay.
we don't dignify. In caring for patient, there is the dignity that every patient deserves. The fact that someone comes to the hospital needing health care does not make them less of a human being.
No, they are shaming them because they are thinking they could be violent.
Even if they were in the normal world, in the normal hospital world, there is also ways by which the doctor approaches the patient, which is not dignifying. Which is not. So when they see them as psychiatric patients, the same thing applies to them. So they wouldn't have any problem with putting them in chains or doing anything just to make them. I've seen places where they beat them up. Psychiatric patients.
So when they beat a patient like that,
Yes.
what is going through his own mind when they are beating him?
No, when they are beating,
Is he aware they are beating him?
he's aware. He can feel this is pain. He can feel the pain.
Are you serious?
Yes, he can feel, even though he has other problems, but his receptors are working. He can feel the pain. He feels hunger. He feels like every other human being. So
No, you are not serious.
he feels everything.
But so when they tell him to fast, he's feeling hunger.
He's feeling the hunger. He's feeling every normal thing like every other, because
So when they are beating him like that, he's feeling it.
he's feeling the pain. They cry, they scream, they shout. They try to fight back if they can fight it back. So that dignity of in the treatment of patient, I think a major.
So the shame that is in his leg, he's feeling it.
He's feeling it.
No, it's very sad because as a psychiatrist in training, I know how they handle cases.
So why can't we involve police in this situation?
There's no law and order. There's no law and order. Because I'm coming, let me say what happens. Because they can use the violence as an excuse, but in psychiatry, what I know is that when a patient is violent and is prone to causing havoc to people around, they are kept in an enclosed area, not chained. So there's a special room that no matter what they want to do, and they are under observation 24/7. So they are in an enclosed area where they can't harm anybody. And they are also under observation in case they want to harm themselves. Not chained. They have the specific room that has the camera there watching them, making sure that these ones they are safe and they are not going to harm themselves. So why would you chain somebody?
But I think we should be able to have the right to bring the police and law enforcement order into these churches.
Chaining them alone, if it was in my country, it's already below the law. If you just chain somebody, doesn't matter that person stole somebody from you or whatever, you don't chain a person in Namibia, according to our law. In looking at them, whoever chained them, I don't know the law in
because
Ghana,
even me, I am ignorant.
Oh,
I
are
am
not
so
allowed to chain a
ignorant
person in
that I didn't know that when they have lost their senses like that, well, I think that maybe they are not, okay, there is no danger since they are not feeling, because they are not here, they are not in this reality, they don't know what's happening, they don't even recognize their mother or their wives and their husband. So it means they don't even know they are chaining them, or they don't know they are beating them. That's what I thought.
No, there are different type of. There's someone that you'll find is a man that he's having a mental disorder. You ask, what is your name?
No. But
Where
pain, can
are
he
you?
feel pain? Is what I want to know.
They will feel. They feel pain. They are functioning just like us. The only problem they have is
No,
mentally.
even when he cannot understand his mother and he can still feel pain.
Yes. They can. That's why they are not even wearing nappies. They are
Okay, when
feeling.
he's naked, what he doesn't, for a normal person like us, if somebody doesn't even know that he's naked. So the logic to a normal person is that just for you doctors to know how I am feeling, even me, Pastor Sunday, that thinks, and talk less of other people, everybody is like me. We that have not studied medicine and have not studied psychiatry, we are thinking, if somebody doesn't even know that he's naked, because that's one of the most sensitive something to any human being. Nobody wants to be naked, especially public. That is the highest level of awareness. So what we are now thinking, in fact, that awareness of going public is even stronger than the awareness of pain. For example, there is no way you will beat me here now to make me undress and go to the street. You beat me, kill me, but I will not go. So the awareness of nakedness outside is stronger than pain. Now, when somebody can lose that awareness and go to the public square naked, we are now thinking, naturally, it means that he's not aware of himself, and therefore he's not aware of anything. So you can beat him, you can shame him. Even these people who are shaming him and beating him, they are thinking like I'm saying now. They are thinking that he's not aware. So what is the he's not eating, he's on, because someone is not aware he's naked. So what is why should we even be feeding him? Why should we even be giving him food? Why? Because he's not even aware if he's eating or he's not eating. So you mean you'll be hungry?
These people, the only thing that's mostly affected in them, hallucination, delusions. Hallucination, that person will hear
so
voices.
So he will be feeling pain.
Yes, will only hear voices, but his body is functioning. He will hear people talking, or he's seeing things that are not real, or he's smelling something that is not real. Only those three things, or...
No, but he's not seeing that he's naked.
The reason he's removing his things, he's hearing voices that are telling him that remove your things.
But he doesn't know that he's naked. Okay, so he doesn't know that he's naked. He has removed his things, but pain he will feel.
Yes. He
He will
will
feel
feel
cold?
cold. Yes. He's just obeying to that person that is talking to him. But he's just functioning in a normal way. He's hungry. He feels sleepy.
Are you serious?
Yes.
Ignorance. All of us are ignorant. So that's why I say it will be, you people don't even know how much deliverance you will bring to the society at large by bringing awareness to this thing. Even me, someone like me, I'm ignorant. And most of people, they don't even want to hear what we are talking about. If you check the list of the name of the number of people watching, I'm sure people will have dropped off. People don't want to hear about it at all because there is a taboo associated with it. Over to you.
So, Pastor, you're talking about how if these people will feel, they feel everything. They feel pain,
Even when they are naked.
even when they are naked.
And they are with the garbage in their head.
Everything. Why? Because these are all different pathways. For example, talking about sensation, the sensation has nothing to do with their perception, because there's sensation and there's perception. What they just have that is wrong.
No, because most of us think that everything goes to the command center of the brain. And since it's the brain that controls all that the brain is malfunctioning. So the part of the body that is responsible for the awareness is not there. So the part of the body that is responsible for pain is also not there. Or that's what...
It's just a part. So the brain is so complex that it might just be just one minute. That's something about psychiatric issues. It might just be just one minute part of the brain that lost it, or that there was a problem, or
So all that part of the brain are
every
working.
other thing is functioning perfectly. Every other thing is functioning perfectly.
But they don't. But you said every other thing is functioning correctly. But they don't see you.
Yeah, because it's just their perception. It's that area. It's just the part that. It's just that part. It's just like someone. Let me give a very practical example.
They don't see you. They don't recognize you. So we
Yes.
think those are the highest awareness thing that human beings have, to see and recognize.
Yeah, because in the brain there are different centers of the brain, and what you're talking about is one of the high centers of the brain that has to do with recognition and perception. But when it comes to, because in the brain there are several levels in our brain. There are some ones that are controlled by our sympathetic, parasympathetic and parasympathetic. So okay, let me break it down. For example, things that have to do with feeling, sensation. All of those motor functions. Those are not necessarily in the higher centers of the brain. They can be controlled by the spinal cord. Yeah. So there are two. There's the spinal cord and the brain. So the brain is the higher center that controls intelligence and all of that. But there's some other parts of our body that can send in the information about pain, about what we feel, sensation. Those ones are controlled by the spinal cord. So it does not even get to the brain. So as long as the spinal cord is working effectively, no problem. The nerves, everything is working. They can feel the pain. They can feel everything. If it's cold, they feel cold.
So those people, even though they don't recognize their mother when they come in there, but that shame they know is there.
Yes. They sleep. Everything is, every other thing apart from just that area.
No, but the impression you have with the mad people in Africa is that they don't sleep. Because anytime you go there, they are aware, they wake up. Even if they do like sleeping, you just walk near to them, they are like awake.
Yeah.
Okay.
Yeah. They are different. There are different expression of these things, but in summary, these guys
they are okay.
They are okay, and these guys can be restored.
Please, so if you people don't make arrangement to begin to do a program about health, total health, you are going to have problem with me.